I saw addiction in the greater Philadelphia community, and I was drawn to why this community was so misunderstood and how we could look at fellow humans in a way that stripped them of the humanity that they deserved.
Our program name is the Presby Addiction Care Program. We're looking to support the population with substance use disorder, especially in the healthcare field, and address issues related to medical mistrust and premature discharge rates.
A lot of patients with opioid use disorder have been leaving the hospital before doctors deem it safe to do so. A lot of patients just feel uncomfortable because in the past, this population has been marginalized in all settings. And then another is just withdrawal in the hospital.
There's just a lot of stigma associated with using drugs, and that overlaps with a lot of uninformed healthcare providers who perpetuate that stigma in judging these patients as if addiction was a choice.
The goals of the program are to help those struggling with substance use disorder get the treatment and help that any other Philadelphian receives by making the hospital stay more equitable for these patients.
Presby Addiction Care Program provides resources and training for compassionate hospital care. Anushay, Brianna, and Catherine are collaborating with Penn Presbyterian to better serve patients with substance use disorders. Their work is an incredible example of patient-centric advocacy translated into practice.
Our program hopes to put volunteers in patient rooms of those identified with addiction, and we hope to give the compassion that these patients need such that they stay the length of their treatment, and as a result have better health outcomes.
Our main core component is the volunteer portion of the program. Students from universities in the area and even medical students will come in and be able to provide that compassionate support. We just want to be there for these people, not enforcing anything upon them, just being there, listening to them.
And that extends beyond just the hospitals, just giving them the resources to continue going on and connecting them elsewhere.
I think our students are uniquely qualified in that they've done volunteer work with multiple harm reduction organizations in the city.
A lot of volunteering and doing this type of outreach requires trust, and this is multifaceted. It goes both ways. Winning this award specifically for the type of project we're doing has restored so much faith that people do care about those struggling with addiction.
The biggest thing for me is just reminding everyone that everyone's human, that these people should feel comfortable being in a room and not worried that they're going to be mistreated.
It's healing for me to interact with community that's so misunderstood and give them a chance at understanding.
I go to such a good school. There are so many resources here. What better way to utilize those resources than giving back to the community that we live in?